was first diagnosed with breast cancer at age 34. A shock. Unbelievable. You know, this just can't be happening to me.
Having cancer is not necessarily a death sentence.
I'm Nicole Johnson. There's probably no more feared medical diagnosis than cancer. Coming up, we'll hear the stories of local men coping with prostate cancer. But first, for women, breast cancer is of particular concern, with a new diagnosis in this country every 3 minutes. So how do these women cope? How does one find peace in the midst of breast cancer? Shock and disbelief are usually the most common reactions for women who learn they have breast cancer, and it was no different for San Diego's Inez Elliott.
First of all, I couldn't believe it, as many people do. I thought that there had been an error in the lab with my specimen.
They found mine on my first mammogram. It was just a small spot, so I was lucky that way. But the typical things I think that women go through, it's got to be somebody else's. You know, it can't be me. Why me? All those kind of things.
Two years after I finished the chemo, my cancer returned in my bones. So now it's been almost 3 years since the recurrence. I have gone through 3 or 4 rounds of different chemos, and I've underwent 2 stem cell transplants, and I'm in remission.
I had a lumpectomy and my lymph node dissection, which was clean, and then I had radiation and chemotherapy, both. And I was actually a survivor for 5.5 years, and then it recurred 2.5 years ago. Why me? They told me I had the best case scenario. Why did I get it again? And I found that those are really questions that aren't answerable necessarily. There's no rhyme or reason.
Okay, very good.
Dr. Vicki Jones is an oncologist and an associate clinical professor at the UC San Diego Cancer Center.
So when you're first given the diagnosis, everything seems to be all in a jumbled up mix-up, and you have a sense of no longer being able to trust certain things that you used to be able to trust your body, and now it's betrayed you in a sense. For women who are diagnosed with breast cancer, we have a number of newer treatment options that make our ability to talk to them about their longevity much more enthusiastic. Things such as lesser surgery, different ways of giving radiation, and different types of systemic therapies. That's chemotherapy and hormonal therapy, but things that mean that women, when they're diagnosed with breast cancer, it's not a death sentence. And we should be always very clear that we can be helpful.
Diana Dyer is a registered dietitian who's made specific changes to her diet and lifestyle since her cancer journey began.
I was first diagnosed with breast cancer at age 34. A shock. Unbelievable. You know, this just can't be happening to me. I was so young, I had a young family, and wow, where do you even start? Well, I went through all conventional therapies and recovered just fine. Right after my 10-year anniversary mammogram, I then had a second diagnosis of breast cancer on the opposite breast, and whoa, this was a huge shock. If I thought the first one was a shock, this one was even more so. I did go through all conventional therapies with my second breast cancer, but with the second breast cancer, I also instinctively knew that I felt like I had to do something else. And because I am a member of the healthcare profession, I am a registered dietitian, I really took it upon myself almost as a personal mission to decide and figure out for myself, okay, what can I do to help myself? With my book, A Dietitian's Cancer Story, I simply have summarized everything that I've chosen to do with my diet. I'm putting my money on vegetables. Lots of food that are high in fiber, whole grains, some soy products. Not a lot, but some. And various aspects of this, whether I'm incorporating fish that are high in omega-3 fatty acids, nuts, seeds, The word here really is plants and phytochemicals, food that basically has components in it that can help thwart or interrupt this cancer process in our body.
Apart from the things women with breast cancer can do on their own, survivors say it's critical to reach out to loved ones for support.
I was very lucky. My biggest and best supporter, and I may cry here because I love him terribly, is my husband. He was an anchor for me. And I know not everyone has that, so I always knew I was very, very lucky to have him in my life because he truly was a partner in sharing the cancer journey with me.
Sharing with other breast cancer survivors also makes a huge difference for many women.
Probably one of the most helpful things was going to a support group and learning from other women that had already been through it.
When it comes to these kinds of situations, you truly are your own best advocate, and it's really important when you are in a medical crisis like this that you do take charge and get as much information as you can and do your homework, and once you go there, it's very self-empowering and it allows you to heal on a lot of other levels at the same time. It's the first step.
Well, I am now 5 years past my last diagnosis, and so, of course, my oncologist and I hope that there's a cure, on board here. But even if there wasn't, I can truly say all of these various complementary strategies, whether it's imagery, whether it's nutrition, whether it's Tai Chi or yoga, it doesn't matter. I think I've done them all. They have enabled my body to heal. And maybe it's more than that. They've enabled my soul to heal. And retrospectively, this is playing the role of Monday morning quarterback. If I had to choose, if I were forced to choose between cure and healing, healing feels so good that I would choose healing.
Breast cancer is always a scary thing for women to consider or face, but there are several points that women should be aware of. We are talking a lot more about prevention. Prevention before there's a breast cancer even diagnosed, trying to identify women who may be at more than the usual risk and doing something about that. There are a number of things that women can do to be taking charge and monitoring themselves. Every woman should be doing monthly breast checks. I know they say, well, why should I do that? Can't I just have you do that, have somebody check it for me? I'm really afraid of trying to examine my own breasts. I might not find something. But if you are doing it on a regular basis, and when we say regular, we're talking about once a month, you become quite familiar with what is normal for you. Every woman is going to be different. And it's so valuable for a woman to know what is my normal checkup like, so that if there's a change, I can be the first one to pick it up. The other is getting regular mammograms. We can't overstate the importance of getting mammograms and the importance of having them regularly every year. It's the series of mammograms that are important. If you are just getting one, that's not enough. It's having a series to compare with.
When I had the cancer diagnosis, it was almost like I had this little voice in my head, and I call it the Jiminy Cricket voice, and it kind of talks to me sometimes. And what it said to me is, cancer doesn't have to kill you. It really is going to give you an opportunity to do some other things. And when you think about it, what you really are here to do is to spread a lot of love around. And if you take that as your challenge, you're going to be okay.
For a woman who's just been diagnosed with breast cancer, I stand before you as someone who has survived it twice. There is light at the end of the tunnel, and I commend you for taking that first step to actually see what you can do to help yourself and to get on that path. You have lots of help, lots of support. You're part of a huge club. I'm sorry you had to join it, but you don't be afraid to ask for help, because we are all here to help each other.
There are some things that we would rather not talk about. Cancer is one of them. But silence won't make it go away, and our fear and ignorance won't serve our best interests. Hello, I'm Art Cribbs, pastor of Christian Fellowship United Church of Christ in San Diego and president of Pacific Media Ministry. Taking good care of our health is a lifelong job, and we have to go about it in the midst of an arena where advertisements and seductions of unhealthy habits threaten us every day. One organization in San Diego is taking a stand to protect the health of its community and the children who live there. Palava Tree is a drug, alcohol, and tobacco treatment agency in southeastern San Diego. The staff works directly with hardcore substance abusers who are trying to turn their lives around and take control over their habits and addictions. The medical evidence linking tobacco products to various cancers and heart disease isn't lost here. The Palava Tree's approach is like tactical warfare. The enemy is substance abuse, and they attack it wherever it's identified, but without demeaning or lowering the dignity of the clients who come here for help. In order for healing to take place, it is first important for people to admit they are sick. That means taking the first step through the door toward recovery. Even in a neighborhood drop-in center like the Palava Tree, people's lives can be saved. When it comes to our health, we are learning how to talk about what's going on inside our bodies. Breaking the silence and overcoming our fears is the key to improving our health.
One of the most common types of cancer found in men is prostate cancer. So what can men do to help in their own healing? Is there life after prostate cancer?
I had no idea that I had a problem. When the test came back, it seemed like I had a lot of cancers, so he said that we really should operate and remove the prostate.
Dr. Richard Hall is a urologist and clinical assistant professor at the University of California, San Diego. He notes that testing a man's blood for the level of prostate-specific antigen, also known as a PSA test, has greatly increased the odds for surviving the disease.
The prostate-specific antigen test is a blood test. It measures a substance which is made by the prostate gland and is present in the blood. It is not necessarily a signal of prostate cancer. It can be elevated in men who have simple benign prostatic enlargement. It can be elevated in men who have a history of chronic prostatitis, and it can be elevated in men who have prostate cancer.
I had been having regular PSA blood tests every 6 months, and all of a sudden it was elevated to a point where they were concerned about it. So my surgeon recommended that a biopsy be taken, and sure enough, they discovered that I had prostate cancer. The entire prostate was removed. After the surgery, they determined that the margins weren't clear. In other words, it was the outside of the prostate gland that was infected, and it had spread beyond the prostate. So I'm undergoing radiation treatments now. I have another 10 to go on that.
That's why it's important to do the early testing. They didn't find mine soon enough. If they would have found it earlier, then they wouldn't have had to take the whole prostate. They can just take, they could have left the capsule and saved the nerve endings and just removed the prostate. So I highly recommend that everybody get early testing.
When you're recommending an ideal form of treatment, in large part you're dealing with the age of the patient, the Gleason grade of the tumor, the general health of the patient, and the patient's own desires. Each patient brings his own personal biases into the discussions. I frequently and very emphatically encourage the patient to seek medical oncology opinion from a competent medical oncologist who has a particular interest in urologic cancers, specifically prostatic cancers. And I think that that gives a more neutral bias to the discussions of radiation versus surgery versus hormonal therapy. It is a team effort, and this is the time when all the input that a patient can get is much appreciated, I think, by the patient.
You should always get a second opinion. You should always question what they're doing. and know exactly what they're doing. You need to be thoroughly informed about all aspects of what's happening to you. I mean, it's your life, it's your body, and the surgeons try and do the best that they can, but the ultimate decision is yours.
Had the singular honor of having prostate cancer.
Sharing with other prostate cancer survivors also makes a huge difference for a lot of men.
I belonged to the Barbershop Society, and in the Barbershop Society they were very supportive, but they all told me that everybody gets it, and I guess half of the guys in the society, or in my particular chapter, had had the prostate cancer surgery.
Treating prostate cancer successfully often causes limited or permanent impotence, but new drugs are making it possible for many men to resume sexual relations after prostate cancer treatment.
The nerve endings that cause an erection were removed, so I cannot have a natural erection. But they have medication that you can take, that there's actually a couple of medications, which apparently not all the doctors are telling their patients, because I've had some friends in the barbershop chapter who've talked to me about their problems, and I say, well, did you talk to the doctor about the Caverjet? What's Caverjet? Well, it's just, it's a shot that you take, and then they have a pill that you can take that works as well. Although the first time I tried the pill, it didn't work, but they have some other methods of making it work, and we've used them both, and they both work just fine. So I would say that since the operation, our sexual life has been just the same as it was before.
We've communicated, I think, especially with the sexual part of it. Afterwards, there was a lot of talking we had to do, a lot of trial and error, and we just kept going, and through that part, he didn't close up. He's always been we've just been able to talk it through, and that helps.
I think it's always a concern when your normal, what's normal in your life gets disrupted. It's something that could unite or divide you, and a lot of marriages probably would fold under that kind of pressure alone, never mind the fact that the disease is there.
We communicate a lot more, and that's something that has caused us to grow closer together. We celebrated our 30th wedding anniversary last week, and you know, we were just talking about the things that we've gone through in our lives, and this is just another step in that lifelong journey.
No, 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 no. I wouldn't take nothing for my journey now. I gotta get me to heaven somehow. The old devil took me and tried to turn me around. I've been offered everything that's got a name, all the wealth untold, worldly fame. If I could still, I wouldn't take nothing for my journey now.
Having been a Christian all my life, it's always been my natural way of reacting to stress or to bad things that appear to be happening is that it's in God's hands, and don't worry about it. Be positive, and just believe and act as though everything's going to work out for the best.
The old devil took me and tried to turn me around. I've been offered everything that's got a name, all the wealth untold.
I wanted to put it in God's hands, but I still worried. But through prayer and through working with pastors that I do, I just felt the peace. Even though I worried, I knew God was going to be there with me to get me through it no matter what.
I get the feeling His power. I say, praise the Lord, I wouldn't take nothing for my journey now. Oh, I wouldn't take nothing for my journey now.
I think you have to trust God to do. He's not maybe always going to answer every prayer the way you want it to be, but the trust is there that He'll get you through no matter what happens.
It's not the end of the world. Just keep your faith, put it in God's hands, and go on about your life.
When the roll is called up yonder, I'll be there. When the roll is called up yonder. When the roll is called up yonder, then